Major depressive disorder, or MDD, is a serious medical condition that affects millions of people worldwide. It affects how you feel, think, and act, often leading to a range of emotional and physical problems. MDD is also known as clinical depression, and it is more than just a temporary bout of sadness. It's more than just feeling sad or blue. It can impact every aspect of a person's life, from their relationships to their work performance. MDD is characterized by persistent sadness, loss of interest in activities once enjoyed, and a range of emotional and physical symptoms that can be debilitating. It is a common mental health disorder, affecting people from all walks of life. Millions of people experience it, and it can affect anyone, regardless of age, gender, or background. It does not discriminate. The good news is that MDD is treatable with the right approach. With proper diagnosis and intervention, individuals can manage their symptoms and live fulfilling lives. Treatment options include medication, therapy, and lifestyle changes. This video will discuss the signs, causes, diagnosis, and treatment of MDD in detail. We will also look at coping strategies for individuals living with this disorder, including mindfulness practices and support networks. Understanding MDD is the first step towards seeking help and finding effective ways to cope. By educating ourselves, we can better support those affected and reduce the stigma surrounding mental health. MDD manifests in a variety of ways. Not everyone experiences the same symptoms. However, some common signs include persistent sadness or low mood. This feeling lasts for most of the day, nearly every day. There's also a loss of interest or pleasure in activities once enjoyed, which can include hobbies, social interactions, and work. Significant changes in appetite or weight can occur, either weight loss or weight gain. Sleep disturbances are common too, including insomnia, which is difficulty sleeping, or hypersomnia, which is excessive sleeping. Fatigue or loss of energy is another symptom, where even small tasks can feel overwhelming. The exact causes of MDD are complex and not fully understood. However, research suggests that a combination of factors can contribute to its development. Genetics play a role. A family history of depression can increase the likelihood of developing MDD. Brain chemistry is also involved, with imbalances in certain neurotransmitters such as serotonin and dopamine being linked to depression. Life events, both positive and negative, can trigger MDD. This includes trauma, loss of a loved one, job loss, or major life changes. Medical conditions, such as chronic illness or hormonal imbalances, can also contribute to depression. Diagnosing MDD involves a comprehensive evaluation by a mental health professional. They use the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, or DSM-5-TR criteria. To be diagnosed with MDD, an individual must experience 5 or more symptoms during the same 2-week period. These symptoms must represent a change from previous functioning. At least one symptom must be either depressed mood or loss of interest or pleasure. The DSM-5-TR also outlines specific criteria related to the severity, duration, and impact of symptoms on daily functioning. This ensures accurate diagnosis and appropriate treatment planning. Treatment pathways. Options for managing MDD. Fortunately, major depressive disorder, commonly known as MDD, is a treatable condition that affects millions of people worldwide. There are various treatment options available, and the most effective approach often involves a combination of therapies tailored to the individual's needs. Psychotherapy, also known as talk therapy, is a common treatment for MDD. It involves regular sessions with a trained therapist. During these sessions, individuals work with their therapist to explore their thoughts, feelings, and behaviors in a safe and supportive environment. Cognitive behavioral therapy, or CBT, is one type of psychotherapy that helps individuals identify and change negative thought patterns. This can lead to more positive behaviors and improved emotional well-being. Medications such as antidepressants can also be effective in managing MDD symptoms. These medications work by balancing brain chemicals that regulate mood. Antidepressants are often prescribed alongside therapy to provide a comprehensive treatment plan. It's important to take these medications as directed by a healthcare provider. It's crucial to consult with a healthcare professional to determine the appropriate medication and dosage. Regular follow-ups are essential to monitor progress and make any necessary adjustments to the treatment plan. Coping strategies. Navigating life with MDD. Living with major depressive disorder can be challenging, but there are strategies individuals can implement to manage their symptoms and improve their quality of life. Self-care is essential. This includes taking time to understand one's own needs and making a conscious effort to address them. Engaging in activities that promote well-being, such as exercise, healthy eating, and getting enough sleep, can positively impact mood. Social support is crucial. Connecting with loved ones, joining support groups, or even participating in community events can make a significant difference. Engaging in social activities, whether it's attending a gathering, playing games with friends, or simply having a conversation, can provide a sense of belonging and reduce feelings of isolation. Seeking professional help, such as talking to a therapist or joining group therapy sessions, can also be beneficial. Stress management techniques, such as meditation, deep breathing exercises, or yoga, can help individuals regulate their emotions and cope with stress. Additionally, journaling can be a powerful tool for self-reflection and emotional release, providing a private space to process thoughts and feelings. Seeking support. Reaching out for help. If you or someone you know is struggling with major depressive disorder, it's essential to seek professional help. Mental health professionals, such as therapists, psychologists, and psychiatrists, are trained to diagnose and treat mental health conditions. Remember that seeking help is a sign of strength, not weakness. There is no shame in asking for support. Reaching out to a trusted friend, family member, or healthcare provider is the first step towards recovery. Please subscribe to our channel for more informative content on mental health and well-being.